Welcome back. Today I am joined by Dr. Mark Stein, who is with RadNet, and we're going to talk to you a little bit about why it is so important for you to make sure that you keep the appointments that you have now for radiology and going forward taking care of your health. Well, welcome. Thank you so much for joining me. How are you doing?
I'm doing good. Thank you for having me. I hope everybody's healthy.
Well, good. Well, our numbers are looking really good here in Laguna Woods area. We are still at 8 counting. So for COVID cases, that's pretty darn good.
Let's keep it that way. That's incredible.
Exactly. And so, to the point of keeping up with your health, tell us a little bit about some of the things that our residents should be considering.
Well, the biggest thing that we're seeing is we had a massive drop-off in our radiology appointments. Mm-hmm. Now, that may be partially protection for the patients, but the problem is that a lot of these appointments are very important. And I'm very worried that by patients not keeping even routine appointments, that we are going to miss diagnoses that can affect their health in the long term. Mm-hmm. And I think one always has to weigh up the risk of going to the appointment versus the benefits of going to the appointment. And I think the important thing here is, what are the risks of going to the appointment? Because I think that's what everybody, myself included, was worried about. I even postponed one of my routine medical appointments because of it. But I think we've got to be very careful when we do that.
Right. Now, we did have the opportunity to speak to Karen previously, and she was talking a little about some of the things that many of your sites have had to go through to redo to accommodate people because of everything that's been going on. Can you elaborate on that and why it was so important for you guys to go through those changes?
Well, the first one is we need to have social distancing. We used to have waiting rooms that could be full. We had seats next to each other. And that's just not acceptable with the present environment and with COVID. So what we've done is we've stopped having people sitting next to each other. We make sure that the seats, even though they are there, are blocked off so people sit far apart. We've also brought in that when you check in, and if you want to wait in the waiting room, that's fine. But if you want, we will text you and you can go and wait in your car or outdoors where you will feel more safe. Right. That's the first thing. The second thing is we have always been very attentive to cleanliness and sterilization within our practice, but we have increased that, where we now clean equipment between each patient. Our technologists wear masks, they wear facial coverings, they wear shields, and RadNet has been very careful. So our technologists have been given, for the high-risk patients, the N95 masks. For every other patient, they're using routine masks. If we know that a patient is COVID positive, we take extra precautions. We try not to do COVID positive patients. And if we do, we need to be told in advance. So if a patient is symptomatic for cough or for severe chest pain, we need to know about it so that our staff can be aware to treat those patients differently, to be more aware of social distancing, to be aware for our technologists, to make sure that none of our technologists come down with this disease.
Now, can I ask you, over the last, several weeks, 8 weeks or so, was imaging important to many people who were going through COVID-19?
So imaging is important, and it's been very controversial. There was initial studies that chest x-rays would be a very useful tool to diagnose COVID. We could do CTs to diagnose COVID, but it turns out that in fact, for the diagnosis of the disease, they are really not necessary. It's really for the follow-up of the disease. So for example, I had a friend who called me, had a cough, had all the symptoms of COVID. This was very early on. This was at the very beginning. And he wanted to come in for a chest x-ray. His physician had told him to go and stay at home and wait there if symptoms got worse. And I basically said, a chest x-ray is not going to change anything we do. You need to do what your physician says. And I actually put him on to some people up at UCI, and he ended up, unfortunately, 5 days later, getting worse. But the advantage was he was already in the system of one of the hospitals and went in, ended up in ICU for a couple of days, and then went home. So it's important to contact your physician rather than just worry about a chest x-ray or a diagnostic procedure, which isn't going to change the management.
Okay, good to know, because, I think people want to know what the process is if they do have it. What are some of the things that they're going to do? Let's talk about what people should do, going forward now. I believe that you have been contacting people who have had missed appointments or people who do need appointments now. It's okay for them to go to get their radiology exams, correct?
Absolutely. I think RadNet was proactive on this very early on, even before the shutdown they had started to put in place. The mechanisms to treat these patients, to do the social distancing, and they've become very aware, and our staff is very aware. They're aware both for the patients, and let's be honest, they're aware for themselves as well. So this is they're very good reasons for it. And RadNet has ensured that our technologists have the necessary protective equipment to protect them and to protect our patients.
Okay.
So you need to keep your appointments that you have.
Okay, perfect. And then may I ask you, what is the most popular ailment that you do, x-rays for, imaging for?
Well, probably the most common is actually chest x-rays for cough, for fever. We do a lot of trauma patients. If you've hurt yourself and you may have a fracture, you definitely need to see a doctor and get that x-ray if you need it.
Right.
We do a fair number of screening mammograms. RadNet made a decision to continue to do screening mammography. The reason being that we're an outpatient office, and our fear was that if patients miss their appointments, they may not come back. And we really weren't sure when we would be able to start doing them again. So if patients were worried about it, they canceled, but we still continue to offer the procedure. It is important. I'm seeing both in friends and in patients delays in diagnosis because patients did not want to go to see their physician, or their physician was working remotely, or physician recommended they have an x-ray and they were too scared to come in.
Right.
I think the important thing here is, as you mentioned, the incidence of COVID in Laguna Woods is very, very low, thank goodness, and let's keep it that way. But for that reason, the risk of coming into an office for a procedure is low. And we take every precaution we possibly can.
So now, are all the offices open now, or is it just a handful right now?
So with the decrease in volume, and we really decreased in volume up to 75% in volume, we closed a number of offices. However, we have kept offices open in every single area. So for example, in Laguna Woods, Saddleback Valley Radiology is still open. As soon as that gets full, we will open up other offices. It is important that we utilize our resources adequately, and also the less number of technologists that are being exposed is important. So we use the facilities we have, and the plan is to open up offices as needed. But every area has an office open.
Okay, that's perfect. And then anything else you'd like to share with us?
No, I think the thing I really want to stress is, if you need an x-ray procedure, please do not hesitate to come in. It is very important that it be done. It is a very low risk procedure. I won't say it's zero risk, but nothing is zero risk. And you always in medicine weigh up the risks and benefits. If you need the procedure, get the procedure done.
Perfect. All right. Well, I appreciate you taking the time. Stay healthy, and we'll talk to you again soon.
Thank you, and you too. Stay healthy.
All right. Thank you.
Thank you.
And we'll be right back after this.